Hi, my name is Brooke Flanagan. I'm a first year paramedicine student currently studying at the University of Tasmania on the Rozelle campus. Today, I'm very excited to share with you my thoughts and research on the immense impacts that a social and cultural background can have on an individual's health and illness. I will be exploring this topic using the Indigenous community as an example to demonstrate how their traditional beliefs and ideologies, along with their socio-economic factors, can impact their health. First off, let's get into a definition of what this topic actually means. Well, a social and cultural background refers to the way religion, traditions, socioeconomic status, education, and beliefs and more can influence a person's behavior, attitude, and overall, it constructs their identity as one. In relation to the healthcare sector, cultural and social differences are very important to recognize, so we as healthcare practitioners and providers can identify patterns and behaviors that can overall impact a person's overall health and well-being. Indigenous culture is based around a very spiritual relationship between their people and their environment. People are the land, and the land is the people. We are the river is us. This forms a very important foundation where Aboriginal people's stories, beliefs, experiences, attitudes are all connected to their land. Aboriginal people hold this belief that all individuals are within this creation of our world and our environment as one. Thus, the notions of exploitation and domination clashes with their worldview. A common mistrust between the Indigenous culture and modern medical professionals has been established over the years, with the belief that Indigenous knowledge is not verifiable by these modern medical organisations, and in return, the Aboriginals have displayed a sense of uncertainty against these modern medical organisations' research, procedures, and policies. This mistrust is either commonly associated with the years of discrimination and genocide they endured, along with the clashing of their cultural beliefs and ours. With the refusal of Aboriginals' trust in the healthcare system, their health is seen to be drastically worse than that of not only white Australians, but other Indigenous communities and minorities such as the Maoris and the American Indians. This in turn has significantly affected the health and illness rates of Indigenous Australians, where their life expectancy is seen to be that of approximately 20 years shorter than that of non-Indigenous Australians. However, I will get into more statistics displaying the poor health outcomes of Aboriginal Australians later in the presentation. Not only do cultural aspects affect Indigenous people's health, but social aspects can and do also have these same impacts. The question when regarding Aboriginal health is, why do they have such poor health outcomes in relation to non-Indigenous Australians? And how much of this gap is related to socio-economic variables such as income, behavioural, and environmental factors? In general, Aboriginal Australians reside in much more rural and remote areas, making their access to basic needs such as healthcare, education, work, fresh food and water more difficult than that of the typical Australian. With little access to educational resources, Aboriginal Australians are less likely to gain higher qualifications, leaving them with fewer job opportunities and lower income levels. Additionally, because of this low level of education, Aboriginals are more likely to engage in unsafe activities that are damaging for their health, such as smoking and a high consumption of alcohol. This portrays how social variables, and in particular in this situation, little education, has affected the Aboriginal community, as they have very little knowledge over the importance of their own healthcare. In addition, the research shown throughout this table portrays how overall obesity is more prevalent amongst the Indigenous community. Through these statistics, we can see that 55% of non-Indigenous males are overweight in comparison to 63% of Indigenous males being overweight. In non-Indigenous women, 39% are overweight, in comparison to 56% of Indigenous women being overweight. These statistics are shown to follow the same pattern in regard to other health concerns, such as thinness, smoking, and alcohol consumption. I will now be moving on to the paramedic perspective of social and cultural backgrounds and how this can impact individuals' health and illness. Pre-hospital care has a significant impact on patient outcome, as it can decipher the difference between life or death. Remote communities not only face a lack of health services, but they also face a lack of medical emergency services, such as paramedics and emergency care providers. This can be attributed to the difficulty of long-term recruitment and retention of rural health workers. Because of the lack of health services and resources in remote regions, paramedics are unable to perform efficiently, and sometimes they may need extra training or skill requirements in order to work in these areas. However, research has shown that emergency services are becoming better adapted to work in these areas. Ambulance services are now required to supply an intensive care paramedic to these rural hospitals when other medical professionals are unavailable. In addition, the role of paramedics in society has changed from something that just used to be a means of transport to the hospital to now, where they can provide better assessment, stabilization, and treatment on scene, which no doubt has contributed to the significant improvement in rural healthcare. To conclude my presentation today, I have highlighted how social and cultural backgrounds can have an immense impact on an individual's health and illness. With my use of the Indigenous community as an example of this notion, we can see just how much of a role their traditional ideologies and values, along with the socio-economic status they are subject to, play a role in their healthcare.